Hi, welcome to UT Southwestern. My name is Lori, and today we are chatting about advanced heart failure. And we have two specialists with us that I'd like to welcome today. We have Dr. Justin Groden and Dr. Mark Drasner. And just as a short introduction, I'd like to share that Dr. Groden is a heart failure and transplantation specialist in Dallas, who has specialty training in caring for people with end-stage congestive heart failure. And Dr. Drasner is also a heart failure specialist who is one of North Texas' leading experts in caring for patients whose hearts are so weak they need heart transplants or the assistance of mechanical devices. Before we start, don't forget to like and share the conversation, and please share your questions in the comments section of this stream. We'll take as many as we can get to in these 30 minutes. Please remember that Dr. Groden and Dr. Drasner cannot comment on specific cases due to patient privacy laws. So let's get started. I'd like to welcome you both, and I thought we'd start with something kind of general just to kick things off. What exactly is heart failure, and is it similar to a heart attack?
So a heart failure really is characterized by a heart whose function is lower than normal. And that can manifest in several symptoms, but really the heart acts like a pump, and when the pump is weak, the pressures can be high in the pump, and sometimes the blood flow can be low, and that can make patients feel short of breath. So a heart attack and heart failure are not the same thing, but the damage from a heart attack can cause heart failure.
Wow, that's really interesting, thank you. So what are the risk factors for heart failure?
So heart failure can be caused by a variety of things. One of the most common causes is a heart attack. If you have a large heart attack or multiple heart attacks, that can cause heart failure. But there's a whole host of other possible factors that can cause it. It turns out a lot of people it's a genetic problem, that it runs in the family, and if your parents have had heart failure, you could be at increased risk of having heart failure. Some people, if they drink large amounts of alcohol, or if they've had chemotherapy, long-standing high blood pressure. So there's really a whole host of factors that can cause heart failure.
Okay, thank you. So what about the signs and symptoms? You mentioned a couple of things, but what things could people look out for?
So some warning signs and symptoms of heart failure: when patients might feel short of breath.
Okay.
They might have the inability to do their normal daily activities. For example, walking up a flight of stairs. If it is not normal to not be able to do that and feel bad. Or patients that have swelling or congestion in other places, so swelling in their ankles, swelling in their abdomen, or if they can't lay flat at night and they get short of breath.
Okay, that sounds like a telling system.
And interestingly, a few years ago, we at Southwestern described a new symptom in heart failure, which is
what's that?
People getting short of breath when they bend forward to like they're tying their shoes. They'll be sitting down, bending forward to tie their shoes, and they get short of breath. And we've coined that a term called bendopnea, where you get short of breath with bending.
Okay.
And it turns out that also seems to be a sign of people who have heart failure.
Okay. So these are things that people can be aware of and check for, it sounds like.
Yeah, I think as Dr. Gordon says, if your breathing is changing and you're getting more short of breath when you're doing activities that you normally used to be able to do,
okay.
Or if all of a sudden your legs never swelled and your legs start swelling up, that's something that you should get checked out. That's not normal.
Okay, so is there anything that we can do, the patients can do to prevent heart failure?
So that's a great question, and I really think that Dr. Drasner and I would be happy to be put out of a job if patients were very good at that. But a lot of the main strategies to reduce the incidence of heart failure are very simple. You're doing what your primary care doctor asks you to do. Manage the blood pressure, treat your diabetes, try to lose weight, manage a lot of these normal risk factors for heart disease. And we've seen from a lot of large studies, a lot of them have been done by Dr. Drasner and a lot of colleagues here at UT Southwestern, and really across the country, that we know a lot of these common risk factors, when managed well, can actually decrease the risk of having heart failure long term.
Well, that's good news.
Yeah, and a lot of it is, as Dr. Gordon said, is take care of yourself. And two things I'll say is tell my patients is, one, know your numbers. If you have blood pressure, make sure your blood pressure is well controlled. If you have diabetes, make sure your diabetes is well controlled. And then the second way I describe it is do the things that your mom told you to do. You know, exercise, eat right, don't smoke, take care of your body. And those are all things that will prevent you from developing coronary disease, which then leads to heart failure.
Yeah, and dovetailing from Dr. Drasner's comment, we actually know from quite novel experiments in one of our colleagues' labs, so Dr. Ben Levine, who's a world-class exercise, or understands exercise probably, I mean, maybe better than anybody, but he studies athletes, and he knows that exercise can actually decrease the effects of age on somebody's heart.
That's very good news. Yeah. Any particular age involved there?
Well, all ages.
All ages, okay. That's good to know. Well, we have a question here from Carter. Thank you for the question, Carter, who would like to know who is most at risk for heart failure?
So, you know, it's hard to say the person who is absolutely the most at risk, but certainly if you've had significant coronary disease and you've already had a heart attack or you've had a bypass surgery, you would be at increased risk of developing heart failure.
Okay.
If you have long-standing high blood pressure and you have not done a good job and has been well controlled, that repeatedly has emerged as one of the major risk factors for developing heart failure. So if you always your doctor always tells you your blood pressure is 150, 160, and over the years it's been like that, you are at high risk of having heart failure.
Oh my goodness. Okay, and what about treatments for heart failure? Is there something that can be done?
So there are numerous treatments that we have for heart failure, and a lot of them come from studies that have really spanned over the last several decades. And commonly, when patients have heart failure and they're doing okay, they're not feeling normal, but they're feeling bad enough to have symptoms, we have several therapies that have proven benefit that can decrease the risk of patients going to the hospital, and then the risk of death, which are all really good things in patients with heart failure.
Sure.
And so these are simple medicines that a lot of patients have been using for their blood pressures, but we use them for different benefits that they might have on the heart.
Okay.
And that's a super important message because you hear the term heart failure and it sounds like, that's it, my heart failed, there's nothing that can be done. That is not true. With modern day medicines, we can really get people better these days.
And by better, I think it's important to emphasize that means improved symptoms, and in some cases, the heart function can actually improve as well. And in rare instances, actually it's not rare, in I would say less common instances, sometimes the heart function can completely regress back to normal.
So like we'll measure how strong.
That's amazing.
Yeah, we'll measure how strong the heart is by a test called an ejection fraction, and normal might be say 60. Someone with heart failure can be down to 20, but now with modern medicine, that 20 can go back to 60 in as many as a third to maybe even half of patients who have that. So there really are amazing advances in medical therapy in the last decade or so, and you don't want to kind of take what I call the ostrich approach. If you have a problem, you should go see your doctor and get it taken care of, because we can do things to really help you.
And it sounds as if you're talking about things that are non-surgical. Is that right?
That's right.
So
yeah, many times for many patients, medications can really make a big difference.
That's excellent news. Well, we have a question here from Jessica, and it's actually a great way to sort of transition over to our next topic. So thank you, Jessica. Her question is, what stage is considered advanced heart failure?
So I'll take that one. So advanced heart failure, really, it's hard to say that there is a fine line which somebody crosses from regular heart failure to advanced heart failure. We will give it different names. We might say that it is stage D. So for example, the American Heart Association and the American College of Cardiology have 4 stages of heart failure. Stage A is at risk for heart failure. These are patients with some of the risk factors that Dr. Drasner was talking about, diabetes, high blood pressure, and that's when we really want to target those risks. Stage B is when somebody might have had a heart attack or they might have valvular heart disease, and they don't have heart failure, but they have structural heart disease. Then stage C is kind of the garden variety heart failure patient that is symptomatic. And so we'll say that stage D is somebody that's advanced. But really what differentiates somebody that is advanced from regular heart failure, or not regular, but from more routine heart failure, is when they're not responding to some of these medications that Dr. Drasner was talking about. Some of these medicines that otherwise improved symptoms, somebody that's had refractory symptoms. So if you're seeing your doctor and you're not getting improvement from the therapies he's giving you, that's a warning sign.
Okay.
And there are a whole list of others, which include patients that have a lot of irregular heartbeats and a lot of arrhythmias, or if they have a defibrillator and it's going off and it's shocking them. Those are signs when somebody's crossing over into advanced heart failure.
Okay.
And oftentimes people will say that for advanced heart failure, it's a group of patients who require specialized interventions beyond the simple medicines that we routinely use. But for our audience, that is one of the messages that Dr. Gordon and I would like to get across, is because if I'm in the audience and I'm thinking, well, I was told I had heart failure, how do I know if I have advanced heart failure? And one of the ways that we identify that is if you've been in the hospital twice in the last year, so 2 times you had to go to the hospital for heart failure, that puts you in the group of patients who have advanced heart failure. And as we can talk about, it's a pretty serious condition, and really you need to go get help for that. So 2 hospitalizations in 1 year, that is a huge warning sign that something's going wrong and you really need to get help.
Okay, thanks for sharing that.
Absolutely.
That sounds really important. We do have a question about younger patients, and this one's from Elizabeth, and she would like to know, are you at risk of heart failure even if you're young, like in your 20s and 30s? Can that happen?
Yeah.
Well, so I think that there's certainly a case-by-case basis, and that really depends on, what are your risk factors if we talk about hypertension or high blood pressure and things like that. When you're young, it's relatively rare, fortunately, but it is somewhat of a lifetime risk, which even though your risk might be low, I think it's very important, like what Dr. Drasner was saying, to do the things your mom was teaching you how to do. Exercise, eat right, and then go see your doctor regularly and make sure that a lot of these common issues, like blood pressure and things of that nature and your blood sugar, are well controlled. Now, of course, that being said, there are alternative reasons why somebody could have heart failure, and that's where we're getting into some of the causes that Dr. Drasner was mentioned that could be genetic, so family history is very important.
And although we all think of heart failure as largely a disease of the elderly, there are young people who get heart failure.
That's right.
And you can get heart failure whether it's through chemotherapy or genetic causes. On the patients we care for, because we get sent to patients who are very ill, we see not a small number of patients who are young and have heart failure. So it definitely happens. It's just much more common in the elderly group.
I understand. Okay, thank you. Here's a question from Ramon, who would like to know if a patient has high blood pressure and it's under control, would they develop heart failure? And if so, how likely is that, and how long could it take?
Yeah, it's a good question, Ramon. If your blood pressure is well controlled, your risk, and a number of studies have shown, is go down dramatically. And so you would no longer be at that substantially higher risk if your blood pressure is not well controlled. So it sounds like your blood pressure is well controlled, which I'm glad to hear. Yeah. And that will definitely mitigate the risk of developing heart failure by keeping that blood pressure under control.
Okay, great. Well, at this point, I'd like to remind everyone that we are about halfway through the chat, so if you got a question, this is the time to ask it. And we have about 15 more minutes, so we'll take as many questions as we can. Tell us a little bit about what kind of education, what kind of training does a physician need to have in order to care for patients with advanced heart failure, and what is special about that here at UT Southwestern?
What's really interesting is that this whole field has emerged in the last 10 years or so of what we call advanced heart failure and transplant cardiology. And it's a group of physicians and other healthcare providers who now take care of patients with this advanced spectrum of heart failure. From the physician side, there are now specialty fellowship programs where you go, after you finish your medicine residency program, after you finish your cardiology training, you then go and do a whole nother year dedicated to learning how to care for this group of patients who have advanced heart failure. So one of the nice things at Southwestern is we have a team now of 8 or 9 of us, and all of us have gone through that type of training. And it's a recognized board certification from the American Board of Internal Medicine. And so our entire team are board certified in managing patients who have advanced heart failure.
Right, and I think it's important, just like other cardiologists might have special training in intervention or in putting in pacemakers, or when I said intervention, I meant going to the cath lab and putting in stents.
Sure.
And they've got special training and special expertise there. That's really our special expertise, and we've got the special training there. And what really differentiates us from a lot of other cardiologists out in the community is where they might see 1 or 2 patients out of 10 with heart failure. That's really 9 or 10 out of 10 of what doctors, or what doctors like Dr. Drasner and I see on a daily basis, including members on our team.
Sure. So you see patients with this all the time, so you have a great deal of experience to draw on. That makes sense. We do have a great question from Kevin. He'd like to know, is heart failure a chronic condition that can be managed, or is it possible for someone to fully recover?
Absolutely.
Really?
So in some rare cases, heart failure can actually be acute, so in the setting of a heart attack, and then there's some other circumstances where that can happen. But in a lot of cases, heart failure is more commonly a chronic disease, especially if it's related to some risk factors, or if somebody's got coronary disease. They've had bypasses or had a lot of stents or several heart attacks.
Okay.
And it's treated as such, like a chronic disease. And this really ties into some of the medications that Dr. Drasner and I were discussing, where he kind of mentioned that there's that 1/3 to up to 1/2 of patients, when started on these medicines, whether they have chronic heart failure related to blocked blood vessels or for other reasons, they have a chance of improving. And then in some rare instances, like we said, the heart function can totally improve.
That sounds like very good news. Thank you. I have a couple more questions for you here. One is, if I'm a patient with heart failure, what should I know about advanced heart failure, and what should I do if I think I have it? Is this something I should follow up on?
Yeah, I think if I'm a patient and I have heart failure, I would want to be aware of the warning signs that perhaps I've progressed into the state of advanced heart failure. And again, that's where if I'm having to go to the emergency room or the hospital more than once in the last year for heart failure, something is going wrong and I may have advanced heart failure. The reason I would want to know that is because if you have advanced heart failure and you don't get it taken care of, it's a very serious illness, meaning many people in 1 year, we oftentimes talk about having 50%, half the patients dying in 1 year if you have advanced heart failure. And so if you're a patient and you potentially have that, you want to know about that and then go get help. And where to go get help, you would want to go to a center that has a team of providers who are adept at caring for patients with advanced heart failure.
Okay.
And specifically, many of those centers would be equipped to offer things like heart transplantation or a left ventricular assist device, or even just perhaps a little extra expertise in caring for patients who really have this serious condition. So I would strongly recommend, if you think you have advanced heart failure, first talk to your cardiologist or physician about it, ask for a referral. But if things are not going right and you want to be proactive, I also would look for an advanced heart failure center in your community. All over the country there are, and go get a second opinion just to make sure.
Great advice. Thank you. Appreciate that. What about the caregivers and the family surrounding the person? Is there anything they can do to help? I heard a lot about diet and exercise. Is that something that you can support?
Well, I mean, I think there's no question on the importance of a strong support system.
Yeah.
Because certainly that cultivates an environment that at least will be beneficial towards a patient with heart failure, that might emphasize dietary adherence and medication adherence. You know, simple things like taking your medicines and eating right can go a long way. You know, and then also, you know, one of the things we want is we want to see our patients, and we want to see our patients succeed. But it's also a two-way street, because they've got to come see us. So a great support system that kind of emphasizes that role really can set our patients up for an increased potential for success.
And then if you do need to progress to a therapy like a heart transplant or a left ventricular assist device, our team evaluates that to make sure that you really do have a strong support team, because once you need those type of therapies, you can't do it by yourself. You need someone to be with you 24/7 for a certain number of period of time. And so that's one of the factors we look at, is what kind of social support does a person have when we're considering them for one of these advanced therapies of heart transplant or left ventricular assist device.
Okay, that's good to know. And heart transplant, that sounds like a really big deal in my mind, alarms go off immediately, but it's actually been going on for a long time and very successfully. Would you like to tell us just a few words about that?
Yeah, it does. When you hear about heart transplant, it sounds so futuristic, and you do have to kind of pause, even us who do this on a daily
Absolutely.
basis. If you think about what we're doing or having patients go through, their hearts are being taken out and a new heart's being put in, it's breathtaking. It really is, and it's one of the most amazing things that we get to be a part of, to see someone who's critically ill go through this and be restored to a normal lifestyle is really a breathtaking part of what our job does. Having said all that, it's a fairly routine procedure now. Our program has recently passed our 30th anniversary. We've transplanted over 600 patients, and survival rates are quite good. We talked about patients who have advanced heart failure. Unfortunately, the expected mortality or death rate would be about half the patients at 1 year. After transplant, that goes up to 13 years. We would expect half the patients to live 13 years.
That's amazing.
So that's, you're extending the duration by over a decade, plus the quality of life, whereas when you have advanced heart failure, I can't even walk, in my house without getting out of breath, to after transplant, you can pretty much do what you want. So it's not only the duration, but it's also the quality. And although 10 years may not be as much as any of us hope for our patients are so grateful. They get a chance to see their grandchild born. Some patients have gotten married for the first time. They go back to work or they pursue their passion. So it really is an amazing field to work in, and such a privilege for us to see our patients go through that and have the success after transplant.
Thank you for sharing that.
Yeah, I would say absolutely. And then from a historical context, we've been doing heart transplants for, the first one was 50 years ago. It was done in South Africa. And really we've come a long way. And like Dr. Drasner said, right now we've got great survival rates. And, it really has transformed the natural history of those select patients where transplant is appropriate. And like you said, it really is amazing. It's one of the best parts of our job. And, especially with young people that unfortunately might need a transplant, it really gives those patients an opportunity to not be sick anymore, where they can feel good and they can really transition to a normal life.
Yeah.
Sure.
And talking about the best part of our job, talk about when we get an organ offer for a patient and we go tell them.
Oh yeah, that's probably one of the coolest things, because they're kind of taken aback. They can't believe it.
They can't believe that they've actually, they're about to receive.
And little do they
this
know
gift.
that it's actually a lot of fun on our side, because we're very excited to offer to a patient where like you said, heart failure is a chronic disease. So we see our patients quite a bit. We know our patients, and we want to. And when it's somebody that we know, and it's somebody that we're very invested in their care, and we have that opportunity to offer them a heart, but the heart means something more. It means a change, and it means a change for a better, that something's finally going to get better, and that's, there's nothing quite like that.
And so they'll be in the ICU, for weeks, months maybe, never knowing, thinking eventually this is not going to happen. And then all of a sudden Dr. Groden walks in, trying to hide the smile a little bit, but they know right away. They say, "What's up?" Like, "We have a heart for you." And then it's just breathtaking what the response, and it really is for us. That is one of the highlights of our job.
That sounds wonderful.
It's not about us, but that's pretty good.
Oh, that'll be an amazing motivation, I can imagine. Well, we have a couple of follow-up questions to that line of thinking, and one is from Carter, who would like to know, in what case would you recommend surgery as a treatment rather than medication? So what types of cases?
So surgery for heart failure, it can come in different varieties. If you have valvular heart disease or blockages in your blood vessels and you have heart failure, we would look at fixing those problems to see if we can get the heart failure better. If you have advanced heart failure and the medicine stopped working, that's when we think about these more extreme surgeries, the transplant or putting in the left ventricular assist device, which we've talked a little bit about, but just so everyone kind of knows what we're talking about, these are partial artificial hearts. They're pumps, basically, and they take over part of the pumping function of the heart. It's a big operation, but if you have an advanced heart failure and you can't even walk in your house, and you know that the odds of living a year are under 50%, and maybe you need to live long enough until a heart transplant becomes available. And we put in one of these left ventricular assist devices, and we keep you alive until one of the hearts become available, for example. So those are, if you have advanced heart failure, and the medicines are no longer working, we would consider you, or at least evaluate you to see whether transplant or left ventricular assist device would be appropriate. If you have less severe heart failure, we like to think about, is there something we can fix, whether it's blockages, a valve problem, something that we can fix to take care of the problem itself.
Okay.
Yeah, and I would really think that I'd like to emphasize that last point that Dr. Drasner was making. And I really look at that as one of our main roles, especially when a patient has advanced heart failure, that we have absolutely uncovered everything that might be reversible to continue to improve heart function.
Mm-hmm.
So I always tell my patients that, I ask a lot of questions, that heart failure cardiologists are very nosy. We try to be very detail-oriented because these details can have big implications. And if we can keep our patients from ever needing a heart transplant or a left ventricular assist device, while those therapies for those that need it are amazing, that's a huge win.
Yeah, it's a
Sure
home
is.
run. If we can prevent that and fix the problem without having to go to one of these more extreme things,
You bet.
we high-five each other. The heart got better. We got the medicines.
Yeah.
We found the problem that we were able to turn them around on. We love that.
Yeah, that's when we're showing off the the echoes and everything. Look at this, side by side.
It's great that you guys get so excited. Well, I have a related question here from Vicky, who would like to know, and by the way, we are almost out of time, so we just are going to take a couple more things here. Are there pacemakers that have both a defibrillator, am I saying that correctly?
Defibrillator.
And yes, defibrillator, and a pacemaker in one?
Yes, so I'll take that question. So that's a great question.
Yeah.
So a defibrillator and a pacemaker can be in the same device, but they're two different things. And I'll start by answering your question. Thank you, by the way. So a pacemaker basically sets the heart rate. And commonly, for patients without heart failure, we'll put in a pacemaker for heart rates that are too slow to try to make the heart rate faster so that patients feel better. A defibrillator is a separate device that is somewhat like an airbag. It really doesn't do much at all. It actually watches the heart rate, and then it watches the heart rate for a dangerous rhythm that might be deadly. And when the defibrillator checks that, it then administers a shock that can reset the heart rate back to a normal rhythm and save the patient's life. So in some instances, in patients that might need both, they can be combined into one device. Now, in heart failure specifically, for a certain subset of patients whose heartbeats might be desynchronous, and what I mean by that, the heart has two sides. And in patients with normal hearts, the left side and the right side beat synchronously. And in some patients with heart failure, both sides of the heart can beat desynchronously. In other words, the right side beats before the left. And so there are special pacemakers with 3 wires that can resynchronize the heart. In other words, take a heart where the right side's beating before the left, can synchronize them, and that can actually have substantial improvements in the right patient.
Sounds like it would, yes.
In both how they feel, how long they live, and it can even improve heart function. Again, back to the high five.
That's amazing. Well, we have about 1 minute left, so I'm going to ask you for a quick sum up if there's something you're excited about recent breakthroughs in heart failure research. Is there anything on the horizon you'd like to share, things that are developing?
Well, I think the advances in the left ventricular assist device are absolutely amazing. And having watched when I first started it, these pumps were this big, and now we're down to this big. And it's all about engineering.
Wow.
I mean, you know that in the next 10 or 15 years, they're going to get even smaller. The surgery's going to get easier to be done, and we're going to be able to apply this to a lot more patients. So that really is, to see this field unfold has been incredible.
Yeah, and I would say dovetailing on that, we have newer therapies that are coming on the market, especially recently in the last 3 years, that are still changing the natural history of heart failure, really on top of already established medications. And then for some patients with more unique cardiomyopathies that might not necessarily be, or heart conditions I should say, that aren't classically from blocked blood vessels, there are new therapies that are always constantly being studied to improve symptoms and improve
wonderful news.
outcomes.
Well, we've heard a lot of good news today, I think, and I hear a takeaway message here of if you have a problem, go ahead and ask questions and get help. And if you're still not happy or as healthy as you want to be, keep asking those questions. Is that right? All right.
Absolutely.
Yes,
Be proactive.
definitely.
Thank you. Well, I really enjoyed talking with both of you today, and thanks to all of you for joining us. And be sure to watch this again and share it with your friends. It'll be on our Facebook page and on our YouTube page as well.
Thank you, Lori.
Yep,
Thank
thank
you.
you.